Hello, I am Dr. Usha Ayyagari. Over the next 15 to 20 minutes today, I'll be talking to you about metabolic syndrome. Now, when we say syndrome, what we mean is that this is not a single disease or condition, that it is a group or cluster of conditions that increase your risk of heart attacks, strokes, and diabetes. What are these cluster or group of conditions? 1. If you have high blood pressure. 2. If you have a high cholesterol level, especially a kind of cholesterol called triglycerides. 3. If you have high blood sugar levels, either in the range that we call pre-diabetes, some doctors may label it as borderline, or in the range where we consider it as frank diabetes. And finally, if you carry a little bit of extra weight around your waist, so if your waist circumference is more than what is recommended. Now, for people in India, the waist circumference is recommended to be less than 80 centimeters for women and 90 centimeters for men. So if you have this cluster of conditions, so either high blood pressure or high cholesterol or high sugar levels or a high waist circumference, in the future you are at a higher risk of heart attacks, strokes, and frank diabetes. Now, people often ask me, Doctor, how do I know that I have these? What symptoms can I have? One thing that you can see is if you look in the mirror and your waist is larger than your hips. So if you're carrying more weight around your belly button, around your navel than around your hips, then it is possible that you have a higher waist circumference. So we call this an apple shape. So people who have an apple shape and a higher waist circumference are at a higher risk. It's easy enough. If you have a tape, just grab the tape and measure your waist circumference around the widest part of your waist. And if it is 80 centimeters or more for women and 90 centimeters or more for men, then you're at risk. As for the rest, I'm afraid you really can't rely on any symptoms. By the time you have symptoms, it may be quite advanced. So the only way you can get to know if you have any of these conditions are by checking regularly. If you have obesity or a high waist circumference, if anybody in your family has high blood pressure or high cholesterol or diabetes, if anybody in your family, your parents, grandparents, uncles, aunts have had strokes or heart attacks, especially at a younger age, so under the age of 50 or 60, then this puts you at a high risk. So under these circumstances, you should be going for an annual checkup. Now you might ask me, at what age should I start doing annual checkups? I'm afraid there is no hard and fast number for that. If you have a high risk, then you might want to start at age 30 or 35. On the other hand, you have no family history, you're relatively active, you're carrying a normal weight, your waist circumference is normal, you're exercising regularly, you might want to wait till you're 40. But under the current circumstances, most employers are offering an employee health check annually for their employees. What you should do is take advantage of this health check and start checking. That's the only way you will pick up the majority of these conditions. So high blood pressure, simple enough. You go to your nurse in your office, stick your hand out, she'll tell you what your blood pressure is. Now, if it is normal, good for you. If it is high, you may want to go back, get it rechecked and consult a physician or a doctor. Second thing, in terms of cholesterol and blood sugars, please don't wait until you have symptoms, because by the time you have symptoms, it might be too late. You should go and get these checked as a matter of routine from the age, as I said, of 30 or 35 to 40, depending on what you're planning. So what if you're a woman? This puts you in a separate risk category. Women who have PCOS, and if you have irregular menstrual cycles, you may be diagnosed with PCOS, and women who have diabetes during pregnancy, what we call gestational diabetes, are already at a higher risk of diabetes later in life. And along with it, if you carry excess weight, the rest of the conditions that we've been discussing about in terms of metabolic syndrome. And again, the only way you will know is to check. Now, how do we make a diagnosis? As I said, go for your annual health check. And if you have any of these, it doesn't need to be all of these conditions. If you have one or more of these conditions, you're at a high risk. And if you have all of these conditions, that is already metabolic syndrome. Why is this important? Because when you have these conditions, and if they're inadequately treated, then there is a very high risk of heart attacks and strokes at a very young age. I'm not talking about at 80s, I'm talking about 40s, 50s, 60s. So at a young age, at the peak of your earning, at the peak of your life, this is when these complications may set in. So what can you do? As I said, take advantage of those health checks, go and do them, get diagnosed. Now, if your doctor tells you that you're carrying too much weight, if your doctor tells you that your blood sugars are either high or borderline, your cholesterol, your high blood pressure, what can you do? There are two things. One, please follow the doctor's advice in terms of any medication that might be prescribed, because this can be life-saving. Please remember, the consequences of inadequately treated conditions like this is quite serious in the future. But apart from medication, what can you do for yourself? The best thing you can do for yourself is lifestyle modification. Now, what do I mean by lifestyle modification? It's not just dieting. It's not just doing one or two things differently. You need to, number one, eat the right food in the right quantity at the right time. You can have the healthiest diet, but say you're eating quite late at night, 10:30, 9:30, then this automatically puts you in the category where you're likely to be obese, gain weight more easily, find it more difficult to lose weight, but it also puts you in the kind of category of people who are at a higher risk of cardiovascular events, so heart attacks and strokes. So what can you do for yourself? The main thing is lifestyle modification. And what do I mean by lifestyle modification? Eat the right food at the right time in the right quantity. Even if you're eating healthy, if you're eating late at night, then you put weight on more easily. It's more difficult to lose weight, and you're already at a higher risk of conditions like heart attacks and strokes. So one simple thing, setting your timings right. Breakfast by 8 to 9 o'clock, lunch by about 12:30, 1 o'clock, dinner by 7, finish certainly before 8 o'clock, already reduces your risk of half of these conditions. The second thing, manage your stress, because no matter how much we try, stress is an integral part of our lives these days, work-related, family-related, financial, whatever it is. Do your best to take some time for yourself and practice relaxation techniques. That might be different for each individual. For some people, it might be reading. For some people, it might be music. For me, it's exercise. I know it might sound a little sad. And for some people, it may be some music or yoga. Whatever works for you to reduce your stress levels, please take 20 minutes out of your day, especially towards the end of your day, to relax. Next thing, make sure that you're getting enough sleep, because sleep is one of the most important and neglected aspects of our modern day health. You must be sleeping around 7 to 8 hours per night. And it doesn't mean that you can, for example, go to sleep at 2 o'clock in the morning, wake up at 10 and say you've had 8 hours of sleep. The deepest part of our sleep, the most restorative sleep, happens between around 1 o'clock and 4 o'clock in the morning. And if you miss that interval, then no matter when you sleep, this disruption in your sleep cycle will lead to a disruption of several hormones and metabolic pathways, and that means that you're at a higher risk of all the bad things in terms of heart attacks and strokes that we've been discussing about. In order to get into a deep sleep by 1 o'clock, you should at least be asleep by around 11 or so. So get into regular habits, set your sleep cycle right from the beginning. Have a rhythm for the last 2 hours before you go to sleep and get into a good sleep rhythm. The next thing is exercise. Now, exercise with weight loss is the best. But even if you don't lose any weight, the simple fact of exercising for at least 30 minutes per day, 5 days a week, 150 minutes per week, does a lot to help your cardiovascular fitness and health. Now, on top of this, if you can lose weight, that is great because it has added benefits. But in order to lose weight, you need to do more than just 30 minutes, and you need to do a combination of what we call aerobic or cardiovascular workouts and resistance or weight training. And you ideally want to do about an hour of cardiovascular and about 20 to 30 minutes of resistance at least 3 days a week. And this should give you approximately 0.5 to 1 kilo weight loss per month. Remember, you did not gain this weight in a day or two. So we're not asking for you to lose it in a day or two, but a gradual, sustained weight loss, hopefully without any rebounds, would be great. Now, when you're trying to lose weight, plateauing is a fact of life. You will lose a few kilos, you will then stop losing. You may stay the same weight if we are lucky for a little while, and then we may be able to get you losing weight again. What is important is at those plateaus, when you stop losing weight, it's really important not to rebound and start losing weight again. So exercise, at least for cardiovascular fitness, 150 minutes a week, or ideally for weight loss. That would be great. Now, this exercise has added benefits of improving your heart health and restoring some of the insulin sensitivity, and I'll talk about this more in a bit, and that will help how your body handles glucose and insulin. Next, I talked about triglycerides. Triglycerides are a kind of fat that goes up. This is a kind of lipid profile in your blood. These triglycerides can clog your arteries, and this causes future problems with metabolic syndrome and all the negative effects we talked about. Triglycerides and glucose are intimately linked together, and when you have high blood sugar levels and high triglycerides, this fat gets deposited in odd places in your body. So it can get deposited in your liver. That is called fatty liver disease, which is quite often seen in people with metabolic syndrome and obesity. And the fatty liver disease impairs how your body can handle insulin and glucose, and in future can lead to permanent scarring of your liver, and a small, very small percentage, but a small percentage can progress to cirrhosis and cancer. Now it's a very small percent, but we certainly don't want any of you to be even in that small percentage. What else can these lipids do? Just not in your liver, they get deposited around the other organs, and especially if fat gets deposited around your pancreas, it stops your pancreas from functioning fully and producing the insulin and other hormones that you need for your body to function well. How can you get rid of all of this? Easy for me to say, takes a little effort on your part. Weight loss. Simple weight loss. If you can lose 5% of your body weight, it will improve a lot of parameters, your blood pressure, your blood glucose levels. But if you truly want to reverse this kind of a fatty liver disease and profile that is negative in terms of metabolic syndrome, aim for at least 10, possibly 15% of body weight loss, and that will give you sustained benefits. So the final bit of this, I talked about blood sugars and diabetes. So when your body can't produce enough insulin and your liver is clogged with fat and you carry excess weight, all these are trigger factors. Initially your pancreas will work harder and produce more insulin, but this can't be sustained, and eventually your blood sugars start to go up, and this is when pre-diabetes followed by diabetes sets in. Now this is not a death knell. Please understand that even at the stage of diabetes, up to the stage of please understand that this is not irreversible. At the stage of pre-diabetes, certainly with weight loss and lifestyle modification, we can bring your numbers back down to normal. Even when you have diabetes, in the first few years, you have a window of opportunity where you can actually reverse this diabetes and put it into remission. But this window is narrow. It is within the first 2 to 4 years. So please make sure that you check and don't neglect it, because once this window closes, we can make your numbers look good. We can certainly try to work on your health, but reversing it becomes quite difficult, if not impossible. So diabetes can be reversed in the initial stages, can be prevented if caught at the stage of pre-diabetes. Even eventually we will treat it certainly, and will make your numbers look good and keep you as healthy as possible. But we've all heard this, prevention is better than cure. So start early and keep it going. Now, that brings me to what we are all faced with right now, the big C word, COVID. So what's happening? We're all working from home. We're all more sedentary. Kids are at home. People don't have the facility or the time to go out and exercise, and that just puts such an extra strain on our system. This has become a new word, COVID weight gain. Like pregnancy weight gain, we now have COVID weight gain. And this is something that is seen so prevalently. Please make an effort to exercise. If you're in a block of flats, use the corridor, go up and down the stairs, walk around your compound. If you're in a quiet road, pick a time when it is not crowded and go out and take a brisk walk. A brisk walk for half an hour is still good for your system. So fit in the exercise somewhere. Again, ideally prevent weight gain. But should you have gained weight over this last 10 months, then please make sure that you do your best to lose that excess weight. And just because it's COVID doesn't mean that we don't have access to medical facilities. We're all here, we're all working. If you think you've gained weight, if you have the kind of family history I talked about, come on in and get your health check done, because the earlier we catch it, the earlier we can treat it and reverse it. The treatment consists primarily of lifestyle modification in the early stages. You will not need medication, hopefully. But if we lose that window, we may need to be more intensive. Now, what do you need to do? We talked about it. Eat right. Most people know what eating right means, but remember, we have trained dietitians who can help you and fit it to your special dietary needs. Supposing you're a woman planning a pregnancy, what your dietary needs would be different. An elderly person, post-menopausal women, men over the age of 60 have different requirements in terms of their protein and other dietary components. So this is best done with a little bit of guidance, because we want you to lose fat. We don't want you to lose muscle or lose your bone strength. And this can be achieved quite healthily. Sleep patterns, please talk to us. We can help. And if especially you suffer from snoring, if you suffer from what we call apneic or hypopneic episodes, so this is where people notice that you stop breathing or you wake up with a jerk and you feel like you've been woken up suddenly. This is something that goes with obesity. It's called sleep apnea. We have specialized services that can help manage this. Sleep apnea is a condition that independently increases your heart attack risk and stroke risk and risk of death. Every one of these things can be managed medically. Exercise, yes, start walking. If you can do something more than that, great. Now, don't tell me you don't have time to exercise. Everyone has 10 minutes in a day. And if you can put together 10 minutes 3 times a day, we're in business. You can start with that. Even somebody who's absolutely not exercising can still start walking 10 minutes 3 times a day. It will not put such a huge strain on your system. And as you get used to exercise, we can start increasing this. So come in, do your tests. We have expert input available. We can guide you on your wellness journey, because I don't want this to be an illness journey. Let's catch it before you become a patient. Let's keep you healthy and keep you well, because we don't want to take this to the point where it's an illness. Hopefully, you have had some information about metabolic syndrome today. The main factors, as I said, keep your weight down, keep your waist circumference in a good range, under 80 for women, under 90 centimeters for men. Check your blood pressure, cholesterol and sugar levels. Think of your family history. Get moving, stay active, stay healthy. Thank you very much. This is Dr. Usha Ayyagari.